who was admitted for a panophthalmitis by the ophthalmology service, and we've been following her comorbidities, which primarily include AFib, hypothyroidism, and she has a St. Jude's mitral valve. So she's been doing well through her course, but overnight she had a very high blood pressure, 213/91 that required hydralazine, 10 milligrams times 1. Also at that time, she was found to be a little disoriented. She was standing behind the curtain. She had a dry erase board in her hand, and she was very agitated. The nurse had to really calm her down to get her back in the bed. After that happened, she had a recorded low blood pressure as well. I believe it occurred after the hydralazine was administered, but I need to investigate that a little bit more. So this morning, in conversation with her, the patient appears to be borderline delusional. She has a feeling that her sister has placed her here and is hiding her here from something or someone. She feels that I'm complicit in that activity. She says she thinks she's still in Shands Hospital, but isn't sure. So that's the gist of it. Overnight, her Tmax was 36.3. Her heart rate was 90. Her blood pressure was 161/90 when I saw her this morning. Her heart rate was 22. O2 sats were not performed. Her chemistries were all within normal limits. Her white count was 5.9. H&H is 12.7 and 36.8. Platelets were 232. Essentially, ophthalmology is signed off at this point, but we've been following the INR, which is 1.8 today, up from 1.5 yesterday, 1.4 prior to that, and 1.4 prior to that. We're attempting to achieve a therapeutic dose between 2 and 3. On physical exam, she has no change in her exam from baseline. She has a murmur and a mid-systolic click consistent with her St. Jude's mitral valve. And the remainder of her exam is non-focal besides the mental changes already discussed. So the assessment is a 6-year-old female with recent delusional activity, possibly related to the fact that she's been receiving an ophthalmic eye drop regimen, Q-hour, for the last several days that she's been admitted here. So she's awakened once every hour during that time to have eye drops administered. Also, the eye which was affected is her only good eye, and she now has essentially no visual function except for light perception and occasional movement. So two very disorienting features of decreased visual acuity and sleep deprivation. I'm not sure that a psych consult was warranted at this time, but perhaps consult with ophthalmology and consider scaling back her eye drop regimen if that's possible at this time, just to allow the patient to sleep more. She is receiving Coumadin 5 milligrams every day and has for 4 days now. Her INR is responding appropriately. Expect it will be therapeutic next day or so.